Thank you for joining, everyone. I'm Dr. Bob Murray, Chief Medical Informatics Officer for NextGen Healthcare. And this webinar today is going to be about how to prepare for a successful Spring 21 upgrade. And I have with me today Sarah Green, who is the VP of Commercialization. Sarah, you want to say hi to everybody?
Hi, folks. Good to talk to you today.
Perfect. You sound great. And we also have Lisa Norman from the telehealth team. Lisa, say hi.
Good morning, everyone.
So today's agenda is going to be about an hour long with plenty of time for questions, and please do put your questions in the Q&A panel on the WebEx. We want to very briefly go over some of the key enhancements in Spring 21. We've had numerous other webinars that have gone over those in great detail, so that's not really the point of today's webinar. But we do want to go over the information that we can share with you about the upgrade process and what you can do now to help prepare for that upgrade. This is kind of part one in a two-part series around how to prepare for the upgrade and what you can be doing, and the next webinar in that series will be around this time in early August. I'm going to talk about the upgrade resources that we're going to bring to bear, recommendations for what you need to bring to bear, what I said you can do to prepare for your upgrade, and of course lots of time for Q&A. So don't wait until the end to pop your questions in that panel. Do it along the way, and we will either answer them along the way or at the end, whatever makes the most sense. So hopefully most of the folks on this call kind of know a lot about Spring 21. If you are still catching up, that's not a problem, but we have numerous other recorded webinars that will go into as much detail of the features in Spring 21 as you would possibly want to. We started it off with our Spring 21 First Look event in March, and then last month we had the launch event, which was a live Q&A with presentations and videos from there. There's also numerous other printed documentation and videos to watch all about Spring 21. But at a high level, Spring 21 is a major release because it is bringing to bear on a single platform many of the components that we have been investing in over the last couple of years and many of the acquisitions in terms of other companion technology to our main practice management EHR system that we have brought to bear in the last couple of years as well. Those are coming together in the Spring 21 release. And so one of the main features in that release is a shift to the new patient portal, formerly known as the MedFusion portal. And so absolutely crucial to this upgrade is the fact that if you're on the legacy NextGen portal now, when you upgrade to Spring 21, you're going to move to the new portal, which we believe to be quite a bit better for your patients as well as for your practices. And so Spring 21 allows you to get better control and to really engage the patient and manage that patient experience better through the portal and other components that we can go into. Spring 21 also brings some major usability improvements to clinicians in terms of the new SOAP template, the new intake template for the clinical staff, as well as lots of other usability enhancements throughout the system. It also brings to bear some new practice management capabilities, including a cost estimation tool that's built into practice management and new operational analytics if you are using the NextGen Financial and Operational Analytics tool. It has a new interface with the population health traffic light, and so that plus all the other built-in risk management and clinical support tools in the system allow you to better manage risk. And finally, there are some major interoperability features in Spring 21. There's the ability to import lab results that might be contained in a CCBA document you got from outside your practice. There's also lots of APIs with which you can share data with third-party applications or with patients and other major interoperability features. So lots more detail on this in other webinars, but kind of at a high level, this is what the release might mean to you. The majority of you on this call will probably be upgrading to Spring 21 because you have to. There is a fairly strong regulatory requirement for most of our clients, but not all. If you are required to be on certified EHR technology, ONC certified for any reason, and so you might be a MIPS MACRA provider, or you might be participating in CPC Plus or Primary Care First, or you might be in a number of other arrangements that require that ONC certified software. Well, through the 21st Century Cures Act, the latest version of that certification is called the, confusingly, 2015 certification Cures Edition, and it is the Spring 21 release that will obtain that certification. We're going to be certifying it later this year. It'll be posted on the appropriate website, which is called Chapel, probably early next year. So that Spring 21 will be the release that you need to go to. At this time, the deadline for many of you to upgrade will be, you have to have it in place by the end of 2022. That's always subject to change, depends on your individual circumstances. We can talk about that on another call. But basically, most of you have 18 months to take the Spring 21 upgrade because you're going to be required to for regulatory reasons. But because of this upgrade, and because it's combined with the portal transition for many of you, we were taking a really different tack, we at NextGen, on the upgrade process, and that's what we want to spend the majority of time talking about today. So here's just some more information about the regulatory requirement. I think I went over that in some detail. And I think I mentioned many of these features, but this is a high-level look at some of the key features for why you might want to upgrade to Spring 21, even if you don't have to, or you might want to do it sooner in order to get these features well in advance of the deadline. But I think without further ado, let me bring back Sarah Green, and she's going to talk to us about this kind of new approach that NextGen is taking with the upgrade process. So, Sarah?
Thanks, Dr. Bob. Yes, I'll get into what he means when he says how we're taking a bit of a different tack here, considering we are delivering both the upgrade and the portal in a combined project for the majority of you. Those that use our portal, that'll be the direction we go. Bob, I think you're still controlling the slides. Do you either want to kick it to me or jump to the next one? Perfect. Great. Something that I just want to get started with is we are changing this process, right? So let's kind of hit it on the nose and get into some of the detail that is pertinent to those of you that are preparing for your upgrades. Because of the combined nature of these projects, this upgrade requires more upfront planning and coordination than previous upgrades. It is the upgrade that you know and love. It is also a brand new portal implementation in association with that. And we want to make sure that's a smooth process for you, right? So we are doing a ton of planning ahead, which I'll get into. We're asking you to plan ahead with us. That's going to be the crux of what we're talking about here, is how do we plan ahead together to make sure that this is a successful process for both of us. We are shifting the way we are thinking about upgrades in a couple different ways. Number one is we're shifting this from being something that has been kind of task-based in the past, something that was a little more reactionary, very technical in nature. You guys let us know, hey, we're ready to upgrade, opened up a case, we did it for you. What we're doing is, because this is tied in with a project, which is implementing the new portal, again, for the majority of you, we're going to shift the overall upgrade to being one that is project-based. Beginning, middle, and end, phases, milestones, clear requirements that go into that project. That is a different take than we have approached upgrades with than in the past. But that is kind of at the core of what we're talking about here. And like Bob said, I'll get into a little bit more detail about this in subsequent slides, but that's kind of the primary difference in terms of how we're delivering this upgrade. We, on our side, are dedicating more resources to the overall process, right? That's for the actual delivery work. That's for our own operational infrastructure around it. We are obviously bringing on more implementation resources because we have a lot of folks to get onto our new portal. There are technical resource requirements associated with this. So again, we are bringing to bear a lot of resources on our side to make sure that we can support you in the delivery of this process. And those resources, many of them, will be dedicated to helping you drive the upgrade project. Again, in a combined effort for the majority of you that are going through both the upgrade and the portal implementation. But even for those of you that are not, we want to help make sure that we are calling out those prerequisites, verifying you guys are ready to go. So by the time you're starting your project, you can really sail on through to the finish without any interruptions along the way. I'm the presenter now. Here we go. We'll go to the next slide. So that's how we're changing. How we're asking you to change with us is, first and foremost, talk about it in advance. And this is one of the big changes because, like I said, previously it was task-based and you can kind of open up your case whenever you're ready to get started and poof, there you go. That's going to look a little different. We need to plan ahead both from a resourcing standpoint as well as a technical standpoint to make sure we're there to support you. So as soon as you know, or as soon as you're just ready to talk about it, even if you just have questions, we can guide you through that process. Reach out to us sooner rather than later. You don't need to be ready to kick off your upgrade to start the conversations. Start them as soon as you can would be my recommendation. We will work with you on project planning. Here is what the requirements are, which Lisa will get into in a second. Here's what the project will look like, which I'll get into in a second, and really kind of setting you up for success to move through this combined project in a successful manner. We will support your organization in staying on track by kind of managing those milestones, and missing those milestones could cause significant delays. And here's what I mean by that. And again, I'm trying to hit things on the nose here, so we're all speaking the same language. But as time goes on, as we get closer and closer to that deadline, we're not going to have a ton of open seats available, right? So if something gets off track in the project and, oh, we missed testing and we want to add, a couple more months worth of testing, or weeks or days even, it may put that go live slot at risk, in which case it's not as easy as just saying, hey, let's do it the next weekend. That next weekend may be booked up, right? And so we may be looking further out down the calendar, and as time gets crunched with that deadline impending, it may look like weekday upgrades. It may get a little less savory as time goes on, is really the punchline here. So we will work closely with you to make sure that you're staying on track, but we're asking you to work with us as well as we're planning ahead for these projects. We're also asking you to commit to the project in a project-based fashion. So again, instead of kind of being a task-based thing where you've got a couple things you need to get done eventually, let's kick off the project together and let's finish the project together, so we can meet those milestones. That, of course, requires appropriate allocation of resources on your side. Most of you who have been through this process know what that looks like for your organization, but we're coming forward with some recommendations so we can really have a conversation about what does your organization need to pull this off. So plan ahead, work with us, and let's get these projects done successfully. Here's what the process looks like to get started in your upgrade. Number one, like I said, as soon as possible, even if you're not really thinking about upgrading until later, even into next year, start talking about it now. 2022 isn't as far away as it seems. And so start talking about it as soon as you are able, so we can start laying out the plan for those prerequisites and really getting that project kicked off. We will prepare recommendations for you based on what we understand of your product mix, the requirements of the upgrade, things like technical requirements, stuff like that. We will say, okay, hey, here, based on what we know about you, here's how we recommend you approach this project. You will make your decisions around what you want to do, right? And then you will sign an order form associated with that. That ranges from a $0 order form where you're saying, hey, I'm just upgrading, or maybe you want to buy some surround solutions, some additional services, whatever that looks like. But make your decisions based on how you're going to approach this upgrade, and then we will begin project planning. So at that point, we'll be able to have the conversation of, all right, let's get into detail about what this project looks like. Let's talk about your resources that you're going to bring to the table, and figure out when we're going to kick that project off, and therefore when that project will conclude. Okay, so that's how you kind of get into the pipeline. Here is at a very high level what that project looks like, right? So the phases will be very familiar to you. This is what the phases look like for any of our projects. It's plan, discover, configure, prepare, launch, right? So getting into a little bit more detail on that, let's get into some of these line items here. So for the planning process, once you decide, okay, this is what we're going to do, and we've signed our order form, again, whether it's $0 or you're buying some additional services, we will have an executive sponsor call where we will have a manager from the professional services team, maybe me, talking you through, here is what the project looks like. Here are our expectations. Here are your expectations of us. Let's figure out what timing and planning should look like. Again, so then we can establish that kickoff and put all of the rest of the milestones in the calendar. Okay. We walk through the contract to make sure we're all aligned on what we are delivering, what you have purchased or not purchased in this case, and make sure that everybody's lined up on what is going to be delivered as part of this project. We will talk about your success goals. What are you trying to get out of this upgrade in the portal implementation? And then we will assign the project team, right? So you'll have a team, depending again on what it is you're undertaking associated with this upgrade. It may be that will determine what the team actually looks like, but that project team will be assigned once we're doing the kickoff work. Okay. When we go into the discovery phase, we do a gap analysis, what needs to get done as part of this upgrade. We are defining our process. We're making training plans. You start building your communication plans, both internally and externally. Internally, of course, hey, here's how it's going to change your workflows for the upgrade, start scheduling training, letting people know this is when the upgrade will be coming. But externally, those of you, again, who are doing this as a combined project with the portal, start letting your patients know this is when we'll be changing portals. This is what it means for you. This is how you'll be able to access your records, starting with that date of go live. So starting to put that communication plans in place happens as early as the discovery phase. And we will also be establishing those baselines, right? Like in association with your success goals. What are we trying to achieve? What is that baseline now, so we can make sure we're measuring ourselves appropriately against that post live. Heading into the configuration phase, you do the build. You're configuring the project, you're updating your custom templates. We are on our side are doing the configuration work for the portal. For those of you that are going through that process of the implementation, you're doing the integration, you're doing test plans to get those ready for the testing phase, and any issues that you find, obviously we go through the remediation process. Following the configuration phase, there's a go, no go decision, right? And we will have that go, no go before we even do end user training, because we don't want to be that disruptive and use all that time if we decide it's a no go. But assuming it's a go, then we go through the end user training, we start executing on that communication plan, and we do an introduction to the support process to make sure everybody understands, all right, when we go to go live, here's how we report issues, here's how we're tracking them. Making sure there's real clarity around that. Then we go live, we do go live support, we are monitoring our volumes and our throughput. We start measuring those KPIs against the baselines like we talked about in the past. And then we do a formal transition to support once the project is closed. Each of these phases will have gates, right? And it'll be, so for example, at the end of the discovery phase, the gate is signing off on, yep, this is what we've decided to do, right? This is our configuration, this is what it's going to look like. We are agreeing this is what the scope of the project is, in effect. And once we meet that gate, close out that phase, we can move on to the next one, right? Now, what we don't want to do is make sure we are moving past the phase without meeting the gate, right? You don't want to move out of testing without completing testing. And so we'll be monitoring those milestones and making sure we're meeting them together. And if we're not, then we have to put those remediation plans in place, right? And if we're way off track and we can't get to the milestone and still complete the project in time, that's when we're starting to talk about those slots, right? Are we going to make this go live, or do we need to talk about a different time frame? Pretty standard project stuff, but I think it's important because we are shifting from that task-based to the project-based, that we're all on the same page about what we're talking about here. Okay. Now I'm going to pass it over to Lisa to talk you through how to prepare for this process. Lisa, over to you.
Thank you, Sarah. So we're going to hop into initially key considerations that we want you to be aware of as you begin to prepare for this upgrade. So the portal piece, as Dr. Murray and Sarah mentioned, this is a big component of our upgrade this year, and we are transitioning all of our legacy clients over to our new patient experience portal. And so initiating that swap and completing that is an important component that will continue moving you forward through that planning phase. There are also additional gateway services that are necessary for all of our clients moving to our patient experience platform as part of the integration into our core solution to really ensure a smooth communication between core and our patient experience platform. There are additional hardware requirements. And on this next slide that we're going to hop to in just a moment, we're going to talk about some of the key components of those requirements within the technical components. For any of the clients, any of you all that are live today on our NextGen Legacy or our patient experience portal today, we have a process. There are some utilities that are going to be migrating from our former MedFusion solution to our new patient experience portal. And so that's something that's going to be discussed in the upgrade. I support these upgrades as wearing a new hat as an upgrade support specialist. And we are here just to have these conversations to really talk through your unique components of this upgrade, as there are a lot of different moving parts from our acquisitions as well as our other solutions within the functionalities. Behavioral health is another key component of that, and migrating our clients over to our new 4.0 behavioral health suite. So lots of key components, lots of considerations to have as you move through this process. All right, let's see if I can figure out how to move. There we go. Okay, so these are some really great resources for you all when you're preparing your system. There's initially some technical components and some prerequisites that we want to make you aware of. That Microsoft SQL Server version is really key and a really main component that we want to ensure is a technical prerequisite that you're aware of, as well as that Windows Server. So those two versions are listed there. There are some additional hardware requirements, as I mentioned, for that patient experience portal, as well as other solutions within the platform. So on our path to NextGen Enterprise Spring 21 within Success Community, there are a lot of resources that are available to you all to help guide those technical prerequisites. So in a technical, there's a whole category there that'll really talk to you about the compatibility as well as that third-party infrastructure that you need to be aware of for our Spring 21 upgrade. We talked about our executive sponsor call. This is a new change process that we're layering into this project-based upgrade, and it's really important to have the right project team in place to ensure that this is successful. Sarah mentioned our phased approach and our gates. We want to ensure that we have a project lead, a core team from the technical and the clinical side, as well as your office staff, to really ensure, again, success throughout this phased approach in this project-based upgrade. So next steps after phase or after planning, our next phase is to move into that executive sponsorship call. So thinking about who's going to support that from your team and how we can really collaborate together to ensure success with this change effort. Within that executive sponsorship call, the next phase within that is to be assigned a project manager. That project manager is going to kick off this project with your team and ensure that all of those prerequisites are met and that we're moving through these phases and this gated process together in a collaborative fashion. So there are kickoff dates that are specifically assigned based on our slotting availability as well as an overall timeline. We have some really great new tools that we're utilizing this year to be able to really estimate that overall timeline, and that is guiding the process with slotting and go live production scheduling as well. All right, so we're into our next steps. Sarah, am I handing this back to you?
Yep, you sure are.
Right.
So here's where we go from here. Number one is, like I was saying, in that, here are the steps to get started process. Your NextGen account executive will help you pull together that kind of client-specific recommendation of how we recommend you go about this process. So that would be a quote with the necessary components for your upgrade, again, ranging from $0, which is the cost of the upgrade itself, to maybe you want to buy services or additional solutions, maybe you want to look at hosting, things of that nature. That can be born out of a conversation you have with your account executive. Then your team would review that internally and decide, okay, here's what we want to do, sign that statement of work, and get ready to get started with your upgrade process. Then your account executive would coordinate that executive sponsor call with me or somebody from my team to have that the kind of transition into project work, right? We're setting the expectations for here are the specific details of the project. Here's what your team needs to bring to bear. Here's what we'll have. Here's what timeline looks like for us for both a kickoff and a go live. Then that allows you to get started on your technical requirements, technical and team prerequisites, just as Lisa was discussing. So making sure your hardware is in the right place, if you need to upgrade your SQL version, whatever that is that needs to happen in advance of getting started with the project, making sure your team is dialed in and ready to go. And then we'll be assigning that kickoff date. So that's when you'll get your project manager, maybe application resources, again, depending on when this will be, or depending on what configuration of products and services you'll be implementing associated with this upgrade, that's when we would kick off the project. So those are the next steps for those of you that are ready to get started. And again, as soon as you're ready to have this conversation, start it. You don't need to go from step 1 through 5 in the next week. It will definitely take longer than that. It can take the next 9 months if you wanted to, but having that conversation early, having the conversation with your account executive of here is where we expect it to fall within our strategic year, right? The sooner the better is my recommendation on that. Wrapping us up here, and then we'll have plenty of time for the questions that are coming in Q&A. But any other ones you guys have, start thinking about them, put them in Q&A now, because we do have plenty of time to answer those questions. But to kind of wrap it up and put a bow on it, number one is we at NextGen are using this as an opportunity to commit ourselves, and we're hoping you commit with us, to a better upgrade experience, right? We want to shift it from one that is kind of technical in nature, very task-based, to one that is project-based, one that is strategic, right? We know that this is a really key activity, a really key project in your year for your IT teams. And we want to make sure we are there to support you and make it a successful experience. We are asking for your collaboration in that process because it is a change like we were going through. But we really think that with some short-term, there's always frustration in any type of change of process, and with some short-term pain, there will be a lot of gain on the other side. We really think this will result in a much more positive experience with the upgrade process broadly. And we're asking for you to bring your resources to the table, right? Making sure that you have all the right folks and your best folks committed to this project so it can be as successful as possible. That's where we're going. That's the plan for these upgrades. From there, I'm going to go the right direction on the slides. Here are legal notices, of course. Let's take some questions, shall we? Bob, it looks like you've been monitoring Q&A.
Yeah, let me help moderate, I think, if I can. So thank you, Lisa. Thank you, Sarah. Sarah, this first one's probably for you. Megan Kennedy is asking, do the clients have to set the production kickoff date, the actual upgrade go live date, before they can upgrade their test environment for testing?
Let me answer several questions you didn't ask in association with that question, because it seems simple, but it's not quite so simple. So the short answer right now, today as we speak, is we want to do that test environment upgrade in association with the broader project, right? So we want to have the kickoff, then the test environment upgrade, and then obviously eventually a production environment upgrade. And that's because as we're tying, again, for the majority of you, we'll be doing the upgrade and the portal together, which is absolutely our recommendation. And I saw that comment in the chat, which we can get to in a second. But that's how we want to do it now, right? We start the project, we do the test upgrade, then we finish the project. What we are looking at, right, is how do we make this more self-service for those of you who prefer that option? We have to learn, we want to take the bruises ourselves, I think is the right way to think about it. As we are delivering both of these projects at once, what tools do we need to bring to bear? What process do we need to make sure we have really structured? We are being very intentional and putting a lot of resources around these very first initial projects to make sure we can learn those lessons and establish that type of project in the future. So short answer right now is yes. No, I'm sorry. I don't remember how the question was phrased. The short answer right now is we want to have the production date scheduled before we do the test upgrade right now. We would like to eventually get to the place where we can say, hey, if you feel comfortable doing this and we've had this conversation, you've met these prerequisites, whatever those things are, you can go and do it yourself. Until we feel confident in a very repeatable, successful process, we're going to keep it structured as a project and do the test upgrade in association with a scheduled production upgrade. A long-winded answer to what seemed like a very focused question. If that isn't clear, please ask a clarifying question. I'll try my best to answer it.
No, that was great, Sarah. Couple relatively easy questions as well. So does this upgrade have a shorter timeline if the client is not using the legacy portal, or if they don't plan to use the NextGen PXP portal, the new portal that used to be the NetFusion portal?
Good question. It does mean there is less activity in the project, right? So that's the benefit of having this structure with the executive sponsor call, is we get into those details, right? Let's talk about your specific situation. What do you need? What do you need to get done? What other drivers do you have? And let's put a plan in place for that project. But certainly if you're only doing the upgrade because you are not using our portal, then there are fewer complexities to the project for sure.
Great. And I think this might be for both Lisa and Sarah. We have a couple clients that are already on the MedFusion portal. So how does this process differ for them, and what can they expect?
Lisa, you want to take that one, or you want me to take it?
I can take that. Okay. So really the project itself is really going to work the same way. You're going to have that combined project with that go live at the same time with your spring upgrade and the new version of our portal. However, there are some migration utilities, and because you already are live on the one version of our MedFusion portal, there may be a little bit less configuration. There's less lift in that install and implementation of that part of the project. So it may be a shorter timeline as we overlap the upgrade and the patient experience install and implementation at the same time. But the overall project, those phases that Sarah discussed, that will remain the same for your project as well. Anything to add, Sarah?
Great, and I can add a little color to that. Thank you, Lisa. From the clinical side, of course, folks that are using the current MedFusion portal are used to seeing incoming messages as tasks in the EHR, and then there's a special template where they send outgoing messages. So that messaging process does change with the Spring 21 upgrade, and so that's going to be a very important, consideration in your project plan and some training for your users. It changes because it becomes the same as what the NextMD, the legacy portal practices, are used to doing with their messaging. Very powerful capabilities there. We can go into that at another time. But that is an important that's an important difference that the current MedFusion clients will want to be aware of. But you won't have the need to enroll all of your patients in the new portal, and the need to teach your patients how to use it, et cetera, because none of those features are really changing. It's mostly the practice interaction with the portal. And you're also going to pick up some nice new capabilities, like the ability to right-click on an EHR document and send that document to the portal. And there's lots of other good stuff with the messaging there. Okay, we've got a number of questions around how this upgrade will affect EDR, the dental product. And so I can probably take most of them, but feel free to help me out here, team. So remember that EDR uses the NextGen practice management system for its practice management capabilities, appointments and billing, et cetera, and then it has its own kind of clinical documentation system that is a little bit separate than the EHR, although they are in the same database and they do talk to one another, and there are lots of connections between them. So EDR just had relatively recently a new release. I believe the number is 5.0, although somebody might have to fact check me on that. And so you will probably want to upgrade to that release, which you can do in advance of Spring 21. You don't have to be on Spring 21 to upgrade to that latest release of EDR. But the Spring 21 upgrade itself actually won't affect EDR, other than the fact that it will affect the practice management system and give you some new capabilities there. So the short answer is that Spring 21 doesn't really affect EDR, but you may want to be looking into upgrading to the latest version of EDR before Spring 21 as a separate project, and in kind of preparation that could be done long in advance of your Spring 21 upgrade. So did I miss anything, team? Okay.
So the newest version is 5.1.
Thank you.
Just to correct that. And depending on the version that you're on today, you can either go to the UD3, which is compatible with our Spring 21 release, or you can just go right to 5.1. So that'll depend on the version that you're on today, if you're on a much later or lower version. So that's something that we will discuss with your account executive or with your account manager as the USS or the upgrade support specialist will be brought into some of these preliminary conversations to help talk about your unique prerequisites.
Great. All right. Another great question is clients are asking, Don DeSellas is asking, will the clients be able to test the new PXP portal in the test environment?
Yes.
Exactly.
I just wanted to show you I am capable of short-winded answers. The answer to that question is yes.
Yeah, and that's actually a crucial step in the upgrade process, is to make sure that you can do that and you can show your new users how it will work, etc. Now, obviously, none of the information that you interact with on the portal in the test environment will be present in production. You wouldn't want it to be, and we want you to use test patients, etc., etc. But it is possible to test those connections. So. Okay, we have a question that was asked a while back by Jack Rawls, and I wanted to wait a little while to answer it, but it's a very good question, and he is thinking that, well, geez, you know, we're combining these two upgrades, right? The Spring 21, upgrade for EHR and PM, and the portal upgrade, right? And we like the new portal, so maybe it makes sense to actually do that portal upgrade first, and then do Spring 21. And so I'll kick off the answer here, but by all means, team, chime in. So that is possible, but it is actually not recommended, okay? So the scenario here would be you have the legacy portal already, and you are going to upgrade to Spring 21, and that's going to flip you to the MedFusion portal, the PXP portal. And like I said, it is possible, and we have clients that are on the MedFusion portal, but there are enough differences for users that are using the legacy portal. And let's take messaging, for instance. You know, all your practice clinical users know how to send and receive messages from the portal, right? If you were to upgrade to the new portal before Spring 21, that way that you communicate with the patients on the portal would completely change. And then when you upgrade to Spring 21, it would change back. So that's pretty disruptive, right? There are a number of other capabilities that the NextMD portal has that the MedFusion portal before Spring 21 does not have. So after Spring 21, the combination of the EHR, PM, and the MedFusion portal is essentially equivalent to everything that you have in the legacy portal with whatever version you're on now. But being in an intermediate stage where you're on your current version of the EHR and the MedFusion portal, it doesn't have all of those capabilities. So that is something that you can discuss with your project planning team during those initial calls, just to review and make sure that is the right decision for you. So it is possible to upgrade the portal first, but in general, and for the vast majority of clients, we are not going to recommend that. It does add to the complexity of the upgrade project, but the overall outcome will actually be less change for your clinical users, and we believe it will be a better outcome overall. So anything to add to that, team?
No, I think you articulated it very well, Dr. Bao. Thank you.
Perfect. All right, we got another question. And by the way, if you were asking questions in the Q&A, you're doing a great job, but do try to send the questions to all panelists, not just the host, because otherwise you're sending it to one person, then they have to send it to us, and that's just an extra step. All right, next question. This client, Paula Hurst, is hosted, and do they have to worry about the technical prerequisites, or is there a fee for that? Like, how is that going to work for hosted clients?
I think the right way to think about it is it depends, but that is part of the review process, right? Where we prepare those client-specific recommendations, because for the most, well, I mean, it's worth getting into detail, I think is the right answer, but that is something that we will certainly discuss with you as part of that planning work. Lisa, anything to add? I know that you have this level of detailed conversations a little bit more than I do.
I think it's just important to note that for the integration points for the platform into core, regardless if you're hosted or not, there are hardware requirements. And so I did drop in the chat function to everyone that path to Spring 21. So if you're not hosted, check out those ancillary services. And then if you are hosted, as Sarah mentioned, we can certainly have a more in-depth conversation. But there is hardware requirements, whether you're hosted or not, for that smooth integration between our platform, our portal, and our core solution.
Okay, Jack Rawls, actually, again, I'm not sure what's behind this, but it says, it's our understanding that, that we, the clients, will have Spring 21 in test much longer than previous updates. Is that correct, or is it dependent on your particular situation? What's going on with kind of maybe the length of the testing involved with this project?
Here's my best guess. And I'll answer it this way. There is no requirement to have your test environment upgraded for any particular length of time in association with this upgrade. As we have been defining what our upgrade process looks like, there are folks who have moved the upgrade into their test environment in advance of kicking off a project because we hadn't defined that process yet, right? So for those of you who have already done that step, but haven't kicked off their project and therefore don't have your production upgrade, the result will be you have the upgrade in your test environment for a longer period of time. But I consider that to be circumstantial. It is not a requirement to have it in your test environment for any particular time length.
Great. There's another question from Megan Kennedy, who already has the MedFusion patient portal, and I answered it in writing, but I'll just answer it verbally for those on the call. So the question was, they love actually the inbox, the way that the tasking comes in for MedFusion portal messages. Is there a way to keep that? And the short answer is no. You're gonna upgrade when you go to say Spring 21. Your portal messages are going to be on a separate tab. We do think your users will get used to that very quickly. There's a lot of new capabilities that are going to come around messaging, both in that portal tab as well as throughout the EHR. And we've planned even more capabilities to allow smooth sailing there. So unfortunately, a lot of clients who are used to the MedFusion portal tasking way of getting inboxes do like it, and there will be a change for them. Just as an aside, when we show existing legacy portal clients the tasking way of taking messages, they hate it. They want the way they do it. So I think folks are, they like what they're used to, which is understandable. But we do think that having its own tab in the inbox is extremely efficient and does bring with it a number of other capabilities right there, and we'll also have some more in the future. Okay, another question for Upgrade Team. It says, Tom Page asks, it appeared on the slide that there would be some end user training as part of the project. Is this like super user training, or what does it look like? Is there a charge for that training? Let's talk about that for a while.
Yeah, good clarification. The end user training would be delivered by your team, right? So we would pass the knowledge on to you. You would be the ones doing the end user training. That is something that if you decide to buy a service package and you want to add on end user training as part of that, that's available. But the standard process is you folks would be training your users.
And Jim K is asking, is there anything available, either written or videos or anything for behavioral health at this time around the upgrade?
Probably. Lisa, any detail on that?
I know we have some recorded demos for 4.0 for the new transition. I would certainly reach out to your account executive to get something scheduled if you haven't seen that demo. And they can bring in a behavioral health specialist from our professional services team to really look into your unique configuration and the content that you're using and really talk to you about the path to 4.0 and what the best route for you is. So that would be my recommendation, Jim, is to reach out to your account executive and get that demo scheduled.
Yep, and I can add just a little color to that. So the behavioral health suite itself, I assume that's what you're on, is a standalone package that is upgraded separately, but of course you have to be on certain versions of the core in order for that to work. So most of the templates that the clinical users see in behavioral health are going to be driven by what service pack you're on, behavioral health 3.0, 3.5, or the new 4.0. But the practice management system, the way that you communicate with the portal, the way that you task your users, all those kinds of things are tied to the core system. And so how much change there will be and what you want to see in terms of videos depends on where you are, Jim. And so that's another reason to reach out to the account executive, and we can give you some more specific information and highlight those changes. There was one other question. How can you tell if you have the new PXP portal or not? So you would probably know it as the MedFusion portal. If the name NextMD seems familiar to you, then you do not have the new PXP portal. That is the legacy portal. If you look at the URL that your patients log into, for instance, it'll either be, www.nextmd.something or www.medfusionportal, I think, but it'll not NextMD, and that'll tell you which portal you have now. And obviously, when you initiate the call with your account connection, your account executive, they'll be able to help with that as well. Okay. Thank you, everybody, for attending. It was hopefully a valuable use of your time. I will encourage you to attend the second in this webinar in this series. That webinar is entitled "Your Upgrade Process to NextGen Enterprise Spring 21," and it's going to include kind of just more detail and the kind of the next phase for folks that are interested in what happens after this initial steps with the upgrade. So things like what is it going to happens when we're going to perform a system configuration review and look at the workflow reviews? How are you going to design your future workflow, right? And this is going to be where knowledge of the new features of PM and EHR and portal is going to be really crucial, because you want to maximize the use of those features. And with my other hat as the CMIO of a client, an upgrade is a wonderful opportunity to retrain people, remind them what the correct workflow is, whether or not you're using any of the new features, but take that opportunity to do the training to try to get people corralled back in to be doing what they're supposed to be doing in terms of workflow, as opposed to whatever they may be doing now. How are we going to go about evaluating customizations, and how are we going to really prepare users and clinicians, or how are you going to prepare your users and clinicians for the new release? So from my standpoint, thank you very much for your attention. Sarah, do you want to give us any closing thoughts?
Nope, I share your sentiments. Thanks, everybody, for your time. I hope it was useful. Okay, everybody.
Great.